Take our lead. Let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
This risk is present until you're fully healed, which may take 7 to 10 days in many cases. Dry socket occurs when the blood clot that should have formed in the socket after your extraction is either accidentally removed or never formed in the first place. Dry socket is no longer a risk once the site is healed.
Make your mark. Take our lead.
Remember, having an increased pain on day 5 to 7 is not uncommon. To avoid dislodging the blood clot from the extraction site, avoid rinsing your mouth, spitting, smoking or using straws with the first 24 hours after extraction. Smoking should be avoided for at least 10 days to reduce risk of postoperative complications.
Make your mark. Take our lead.
When your tooth is extracted from your jaw, there is trauma to the jawbone, and this will take longer to heal than the gum tissue. The bone will start to heal after 1 week. Nearly fill in the hole with new bone tissue by 10 weeks and completely fill in the extraction hole by 4 months.
Take our lead. Let's help you make your mark.
Symptoms of dry socket. The first red flag will always be the appearance of the extraction site itself. As you look in the area where the tooth was pulled, the opening may appear empty, dry or have a whitish, bone-like color. This is a clear symptom of dry socket.
Take our lead.
If you develop dry socket, the pain usually begins 1 to 3 days after your tooth is removed. Dry socket is the most common complication following tooth extractions, such as the removal of third molars, wisdom teeth. Over-the-counter medications alone won't be enough to treat dry socket pain.
Make your mark. Take our lead.
Tooth extraction is the most common oral surgery. If you've recently had a tooth pulled, you may notice something white form in your tooth socket. In most cases, this white material is granulation tissue, a fragile tissue made up of blood vessels, collagen, and white blood cells.
Make your mark. Take our lead.
Gently eat your favorite soft, mushy foods. Pretty much anything you can roll over your tongue and swallow. Cottage cheese, yogurt, soft stew or soup. Nothing with tiny berry seeds or husks. Use your cold packs the first 24 to 48 hours, applying off and on every 10 to 20 minutes.
Take our lead. Let's help you make your mark.
The bony walls of the socket are exposed to air and cold, which are exquisitely sensitive. As with an infection, dry socket often evolves around 3 days after an extraction, and most commonly occurs in lower wisdom tooth extractions. Smoking, birth control pills, and hygiene are risk factors for dry socket.
Thank you for watching. Please subscribe and hit the bell notification.